Hello. Now we'll be discussing about how we can manage squint without going for surgery. Now our goal is to achieve a normal binocular single vision after management of squint, right? So which type of squint can be managed without a surgery? Basically, a squint which is not a paralytic one, that means it's not a paralytic strabismus. That type of squint can be basically managed with orthoptic exercises, some binocular like vision exercises and all, right? So how do you go about it? First, what we need to keep in mind, we need to keep in mind that we have to give the patient a perfect refractive correction that will be helpful uh, for him, right? So suppose a squint, a patient having an exotropia or an outward deviation of eye, that type of patient, if the patient is myopic, we should correct the patient completely, okay, because it will also correct amount of exotropia, how much of like myopia we are going to correct, it will also correct the amount of exotropia to some little extent actually, okay. So complete refractive, proper refractive correction is very essential in some cases of accommodative squint, in especially in children, accommodative squint, accommodative esotropia and all. Basically squint is actually you can get it corrected by wearing the glasses only, okay. So this type of children needs to be brought into attention at the earliest, okay. So when your child, you are noticing that your child is squinting his or her eyes, you go to a consultant at the earliest and have a consultation, okay, because some type of squint actually can be corrected with glasses as well. So these are called accommodative esotropy, accommodative squint and all, okay. So optical correction is very much important, means that means your glasses is important. Then some kind of squint also can be corrected with prisma therapy. That means Fresnel prisms are available, okay. So in case of exotropia, that means outward deviation of eye, we will give a base in prism, Fresnel prism as well, and for esotropia, that means inward deviation of eye, will give a base out prism. Like this we can to some extent squint can be corrected with the Fresnel prism, okay. So vertical squint also we can try, we can also sometimes like if there is a abnormal head posture, we can give prisms with base opposite to the preferred direction of gaze. This may be helpful in correcting the abnormal head posture, okay, and somewhat it is possible, okay. So whatever vertical deviation, basically it is actually difficult, but horizontal squint, okay, esotropia, exotropia can be corrected with your glasses as well as your Fresnel prisms. In addition to that, you need to go with some eye exercises, okay, that your orthoptist will help guide you in that, how to go about with the vision therapy exercises, and then you can get corrected, okay. So basically a combination therapy will help you a lot, okay. So we have to keep in mind that all kind of squint need not to go for a surgery, okay. Some kind of squint actually gets corrected with glasses, with prisms and with vision therapy exercises, that is very important. But which kind of squint we cannot correct? Basically paralytic squint, it is very difficult to correct with glasses, or like with glasses somewhat you need to give it. Paralytic squint, if the patient is having, you need to give glasses, but it's very difficult to correct it with vision therapy exercises, but still we can give it a try, okay. So in extreme cases, when you are squint is not getting corrected with vision therapy, with optical treatment, with prismotherapy and all, then we refer the patient for surgery. Okay, so always go for a good consultancy, go for a proper evaluation of your strabismus, and then you decide what you should go on. Thank you all.